You know, the longer I work with women in their 60s, 70s, and beyond, the more I hear the same quiet frustration whispered behind closed doors. Why does every appointment feel rushed? Why do I leave with more prescriptions and fewer answers? There's a heaviness that comes from being treated like a list of symptoms, not a whole person. Maybe you've noticed it too. The moment you walk into an exam room and the conversation turns to tests or prescriptions, almost before you've finished describing what you're feeling. Sometimes the recommendations are almost automatic. A hormone patch, another round of blood work, maybe a pelvic exam just to be sure. It can leave you questioning if your real concerns are being heard at all. Here's the truth. Your health journey after 60 isn't about collecting medications or routine tests. It's about understanding your body and making choices that truly honor your needs. Today, I want to share what to do when your doctor makes a recommendation that just doesn't sit right, and how to find the courage to seek a second opinion, even if you've never done it before. Because the power to advocate for your health doesn't fade with age. In fact, it gets stronger with each new decade. I'm Dr. Emily Hart, and I'm here to help you navigate the changes in your body with clarity and compassion. If this is your first time here, welcome to a community of strong, thoughtful women who believe in living fully and wisely after 60. If you find today's insights helpful, I hope you'll subscribe so you never miss a new video. And please tell me in the comments, where are you watching from? I love knowing where this circle of wisdom, support, and courage is growing. Let's talk about those moments when your doctor hands you a prescription, recommends a test, or insists on a treatment, and your inner voice quietly wonders, is this really the right path for me? The truth is, not every test or pill is always necessary, especially for women in their 60s and 70s. Let's shine a light on a few common scenarios where pressing pause, asking questions, and maybe getting a second opinion could be the wisest choice you ever make. First, let's start with the routine pelvic exam. For decades, women were told to get a pelvic exam every single year, no matter their age or symptoms. But the science has changed. Imagine a woman named Judith. She's 68, still full of laughter, but she dreads her annual visits. Every year, her doctor insists on a pelvic exam, even though she hasn't had symptoms for years. Each time, she leaves feeling vulnerable and anxious, never truly sure why it was necessary. Here's what the latest evidence says. For women who are not experiencing symptoms and who have had several normal results in the past, annual pelvic exams might not offer any real benefit. In fact, these exams can sometimes lead to unnecessary worry, further testing, or even uncomfortable procedures. It's not about ignoring your health. It's about honoring your comfort and your autonomy. If a doctor pushes for a routine pelvic exam and you don't understand why, it's okay to ask, what's the benefit for me at my age with my history? Your body is not a box to be checked off on a list. You deserve individualized care that respects where you are in life. Next, let's talk about hormone replacement therapy, often called HRT. This can be a lifeline for some women, especially those struggling with severe menopause symptoms, but it's not a blanket solution for everyone. Take the story of Darlene, who just turned 65. She went in for a routine visit after a few restless nights and some occasional hot flashes. Before she could explain everything, her doctor wrote out a prescription for HRT and sent her on her way. Darlene was left wondering, is this really what I need? The reality is, hormone therapy can carry important risks, especially as we age. Increased chances of blood clots, certain cancers, and even stroke for some women. The science is clear. HRT should be considered carefully, especially after 60, weighing both the potential benefits and the real risks. Sometimes lifestyle changes, gentle herbal supplements, or even mindfulness practices can provide support without the side effects. Don't let anyone rush you into hormone therapy. Ask, what are the risks for someone my age? Are there safer options? Can I try lifestyle adjustments first? Your voice matters, and your health decision should always be a conversation. not a command. Let's move to another quiet but common situation: the quick prescription for bone loss. Osteoporosis is a real concern for many women after menopause. When your doctor sees a drop in your bone density, it can be tempting for them to immediately prescribe medications like bisphosphonates. These medications can help some women, but they're not without side effects, including digestive problems, jaw pain, and even rare but serious bone issues. Picture Sheila, a 66-year-old who walks every morning and eats a calcium-rich diet. Her latest scan showed mild bone loss. Instead of talking about ways to strengthen her bones naturally, with movement, strength exercises, or dietary tweaks, her doctor handed her a prescription and moved on to the next patient. But bones are living tissue, and they thrive when we move, nourish, and support them with intention. Sometimes small changes in exercise and nutrition, along with regular monitoring, can be enough. If you're told you have bone loss, pause and ask, what else can I do to support my bones? Are there steps I can try before medication? Empowerment starts with understanding all your options, not just the pharmaceutical ones. Another common scenario is the cascade of blood tests and screenings. Annual checkups often mean a flurry of lab orders. Some helpful, some not so much. Consider Linda, who is 68 and in generally good health. Every year, she gets a long list of blood tests, some of which are expensive and a few that leave her confused or worried. Sometimes, tests can reveal minor abnormalities that are completely harmless, but once they're found, they can lead to further, sometimes invasive, procedures. The science shows that for women over 60, not every screening is necessary every year. What matters is your individual risk factors, family history, and your current health status. Next time your doctor suggests a test, ask, how will this information help us? Will it change what we do? It's not about refusing care. It's about making sure every step is truly right for you. You deserve care that feels wise, not just routine. And sometimes it's about trust, both in yourself and in your healthcare team. Let me share one last story about a woman named Evelyn. She was always healthy, rarely visited the doctor, but when she started feeling unusually tired and noticed a change in her mood, her doctor brushed it off as just getting older. Something inside Evelyn said, "This isn't normal for me." She found the courage to seek a second opinion. The new doctor listened, ordered the right tests, and discovered she had a thyroid issue that was easy to treat. If Evelyn hadn't trusted her instincts, she might still be struggling in silence. The lesson is simple. You know your body better than anyone else. If a recommendation doesn't feel right, or your concerns are dismissed, it's never too late to ask for another perspective. A good doctor will welcome your questions and help you weigh every decision. And if you ever feel rushed, unheard, or uncertain, you are allowed to pause, reflect, and say, I'd like to talk this over or get another opinion before I decide. Throughout all these moments, remember this. Your health is not a checklist, and your voice is not optional. Aging well isn't about doing everything you're told without question. It's about gathering information, listening to your inner wisdom, and making choices that truly honor your life, values, and unique body. There is dignity in asking questions, strength in seeking clarity, and power in making decisions that fit your one-of-a-kind journey. If something doesn't feel right, you're not being difficult, you're being wise, and you are absolutely not alone. Before we close, let me encourage you. You are the expert on your own life. Your experience, your intuition, and your story matter just as much as any lab result or doctor's note. This community is here to support you every step of the way. If today's video gave you a new question or a bit of courage, I'd love for you to share your thoughts in the comments. And if you know a friend or sister who needs to hear this message, send this video her way. Let's keep building this circle of empowered women. Remember, the best health decisions are made together, with knowledge, compassion, and confidence. I'm Dr. Emily Hart, and I'll see you in the next video. Until then, trust your voice, honor your body, and know you're never alone on this path.